Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
This is Wayne Callan for Attitude Magazine. Today's topic, how foods play a key role in attention deficit, is one of those topics that parents and adults have been asking us about and telling us about for years. There is plenty of anecdotal evidence from moms and dads, men and women, that suggests how eliminating certain foods and adding others to the diet can help with attention deficit symptoms. We are very fortunate today to have Kelly Dorfman, a nutrition detective who works with medical professionals around the country to help adults and children with complex ailments and symptoms. Kelly has a master's degree in nutrition biology and is a licensed nutritionist dietitian in Maryland and the District of Columbia. So welcome, Kelly.
Thank you, Wayne. I'm happy to be here. So nutrition intervention works in two ways. If you're looking at ways that nutrition can help with different kinds of medical conditions, and I call this targeted nutrition therapy, and other people call it other things, but there's lots of ways that nutrition can intervene, and many people, as Wayne have mentioned, have noticed that when their kids eat certain kinds of foods or don't eat certain kinds of foods, that there's a difference in their ability to pay attention. And the question is, how does that work and what things might be affecting them? And mostly this falls down into two categories. There's some kind of irritant, so you'd be removing an irritant such as sugar or artificial color or flavor, or you could be replacing something that's missing. So these are the most common irritants that are discussed when we're talking about attention issues. And I want to make a general statement about how attention and nutrition works together, because attention issues are really symptoms of something else. I know we have a condition called attention deficit disorder, but very often attention deficit disorder or hyperactivity disorder is a symptom of something else. And it can be a symptom of a great many things. And one of those things are nutritional issues, which we're talking about today, but it could also be a symptom of learning disabilities or anxiety or auditory processing issues or visual things, other things that I'm sure you've talked about in other seminars. But this is a subgroup, so it will not affect everybody, and that's a very important thing to know about how nutrition works. Just because your child's affected doesn't mean it applies to everybody, because attention deficit disorder is a very big place. So the four most common irritants are sugar, artificial colors and flavors, food reactors and allergens, and pollen. So let's start with sugar. So you probably heard the research that's been talked about on TV where they say sugar does not make a difference when it comes to attention problems or kids' behavior, so don't worry about it. And is this true? Well, it's interesting. The studies find that if you look at everybody in the study, sugar is not a problem for everybody. But there's always a subgroup of kids, especially when you're looking at children. And also I was talking to Wayne about this earlier, when they've also looked at people who have been incarcerated and who have behavior issues, if you were, as it were. But when you look at sugar, there's a subgroup of kids that are affected by it, but it's not a large enough subgroup that it can tip the whole study very often. So some kids are affected and some kids are not affected, but it looks like it's about 25%. And if you have one of these kids, you know who they are, because you go to a birthday party and they get a big load of cake and ice cream and whatever, and they come home and they really have taken that behavior up to another level or another notch. Now, you might notice, if you've ever gone through the process of taking them off sugar completely, that this does not correct the problem and get rid of attention deficit disorder, but it takes the situation down a notch by reducing the irritants. And that's mostly how sugar works with attention issues. It doesn't make it go away, but kids who have attention issues are very often, or even adults, are more sensitive to these kind of irritants, and so it makes it harder for them to regulate. And we've looked at this, not for a long time. If you look at this slide, you'll see that these studies were done in the 80s. But this man named Schoenfauer went up and down the California coast into juvenile facilities where kids were being locked up for bad behaviors. And he talked the wardens into taking them off sugar. That's it. They just wouldn't have sugar available to them in their diets. And, of course, they were locked up, so there's nothing they could do about it. And they looked at over 1,300 detained juveniles. And consistently, in one institution after another, disciplinary actions and problem behaviors went down 50%. And I just heard there was another study that came out with adults with the same issue just recently. I have to put my hands on it. And they found the same thing is happening, that when people already have issues with impulsivity and attention, you put a bunch of sugar in and you irritate their regulations so that they can't keep their blood sugar stable, and this can destabilize behavior and thinking. So we're looking at a subgroup where this might be an issue. And just to throw in something that's very controversial, there's an MIT researcher named Stephanie Seneff, Seneff, and she has noticed that more people are having trouble with sugar, and she thinks it's not the sugar per se, but the fact that sugar cane and sugar beets are often genetically modified, and they are treated with Roundup, a pesticide, which is called glyphosate. And the residue in this is very irritating to the nervous system, and she thinks the problem may not be so much that the sugar levels are going up and down in the blood, but the problem may actually be a toxicity problem because of how we are raising the sugars that are added to foods, which are normally in the form of corn syrup, which is a highly glyphosinated Roundup is the brand name for glyphosate crop, and so are sugar beets. One of the easiest ways you can deal with sugar if you don't want to go on to a no-sugar diet or be overly restricted is you can cut sugar consumption in half by just getting rid of sweet drinks. They've done lots of research on this, and they found approximately a quarter of the day's calories come from drinks, and a lot of these are sweetened drinks, of course, and a lot of people don't even consider drinks part of the regular diet. But if you just take out the Sunny Delight and the Capri Sun and the juices and the juice drinks and the Gatorades, that will get sugar consumption down 50% in both adults and kids. The average soda consumption is 52 gallons per year. That's a lot of soda. And fruit juice has some of the same issues, although it doesn't have corn syrup in it, and it doesn't have sometimes artificial colors and flavors in it, which can be another issue. But guzzling fruit juice can in some ways be also problematic. So if you want a very quick takeaway, what can we do to get rid of sugar or cut it down in half without doing a whole lot different? And this will also help your grocery bill. Stop buying the sweet drinks and stick to unsweetened tea, milk if you don't have trouble with that, and water. Another issue, the second most common irritant, is artificial food colors and flavors. And you're going to hear me talk about the same old with these, and that is we've done the research on it, and sure enough, not all kids are affected by synthetic food dyes. But it looks like there is a subgroup of kids that are affected by these colors, these artificial colors that come from petroleum. And guess who's in this subgroup? These are kids who have regulation issues, attention problems, and behavior issues. England and the European Union decided to take on this issue in the year 2000, and they commissioned 2 independent studies to finally put to rest, one way or another, do synthetic food dyes bother children's behavior? The Americans always say, no, it doesn't, but when they looked at these 2 independent studies, they found, voila, there is a subgroup of kids that are affected by synthetic food dyes, and enough so that in the European Union, there is a law that if you have artificial colors added to flavor or added to foods, you have to have a sign or a label that says may cause or worsen hyperactivity behavior in some children. So although it did not affect all children, it affected enough children that they were willing to put a warning label on foods that contain these petroleum-based products. The thing about artificial colors is that they tend to be brighter, although this natural one looks pretty bright, and they are more stable and they are cheaper. And so when you see food that glows in the dark, it's usually artificially colored. You can't get that with the natural food coloring, but natural colors are making a comeback because consumers are starting to prefer the natural colors and are concerned about these petroleum-based compounds, which, by the way, FYI, have to be broken down using the same pathways that break down medication. So very often people who have trouble with artificial colors and flavors are the same people who have trouble with medications. When you take medication, if you're the person who always gets the weird side effect or the side effect that's not listed on the label, you may be a person who also has trouble with synthetic colors and flavors because these are using the same pathway as medication. And so they are growing crops now that contain some of these brighter colors and using them more and more in food as the food manufacturers are asking for them. The third issue is food reactors and allergens. And this is a study that was done looking at 100 children with ADHD. They were aged 4 to 8, and they put half of them on an elimination diet. So they were pretty stripped down. They got rid of sugar and corn and wheat and a bunch of, I guess in the first group they didn't get rid of wheat. And they did that for 2 weeks. And if they weren't 40% better, then they removed potatoes and some fruit and wheat for 3 more weeks. And what they basically found that when they eliminated potential irritants, about half the children did significantly better. So 53% in the diet group and only 3% in the control group were rated as doing significantly better with the food elimination diet. So if you're one of those parents who've noticed that there are issues when you with your children with certain foods, but you go to the allergist and they say, no, there's no problem, it may not be an allergy reaction, but there could be something going on that is affecting these kids. In these kind of cases, it's usually not an allergy because if your child has an allergy, you're likely to notice if their throat's clogging up or they're not breathing after they eat a peanut. That's something you would notice and you'd run to the doctor and take care of. But if the behavior has changed, that's something that's a lot more subtle. If you're not having a classic reaction, most of those reactions cannot be found with traditional allergy testing, and so it's harder to run them down. And this is because there is a way that your immune system talks to your nervous system, and it's not always through the traditional allergy pathways. So a traditional allergy is now narrowly defined as a histamine reaction. So if you don't get itchy or have a rash or your throat doesn't close within 2 hours of being exposed to something, it's not considered an allergy anymore. And if you go to the allergist and get scratch tested or have a RAS test, it will likely not find these other kinds of reactions. And it looks like at least half of the reactions people have are non-allergic reactions. They're called reactivity or sensitivities. And we think that the molecules that do this are called cytokines. Cytokines are messenger molecules that are sort of like the Mission Impossible tapes. They deliver their message and then they get, they dissolve. Like, remember the old, Jim Phelps thing, he got his tape and then it went poof, and it went away. And I guess now that Tom Cruise is doing this, it's a little bit more sophisticated. But basically the message was delivered and off the tape went. Cytokines do the same thing. They deliver their message and then they're gone. They're very unstable molecules. And because of this, they're very hard to study. But they're regulating molecules. They change the way inflammation operates. They change cancer factors. They change and flip on and off certain genes. They do all kinds of interesting things in terms of regulation, but not allergy reactions per se. So while they can cause some redness and inflamed reactions, the histamine reactions are still considered the traditional allergy reactions, and these other reactions, these cytokine and other kinds of reactions, we don't have good tests for them. So the only thing you can really do is remove the food and see if you get better, which takes us sort of to the fourth irritant, which is pollen. And there was a research study done in New York by this allergist named Marvin Boris, and he noticed, and I've noticed this in my practice also, that about 2/3 of kids that had ADHD did a lot worse in the spring. There was a lot more Ritalin prescribing. They looked at records through insurance companies and found that stimulant prescribing went way up in the spring. And he was able to link this to pollen reactions. But what was most interesting about this study is that the kids that were reacting to pollen, and it was changing their behavior or their cognition, and they looked at this by getting reports from at least 2 sources, like a teacher and the parent, or a doctor and the teacher. What they found was only half the kids that were reacting to pollen had traditional pollen reactions that you knew it was pollen. In other words, they had red eyes, runny noses, sneezing. The other half of the kids only had behavior or cognitive issues, fuzzy thinking, not sleeping well. In my practice, the most common reaction I see in the spring is chewing on clothes. kids who are suddenly start chewing on their clothes or chewing on sometimes their skin when they weren't doing that before, and this is the sign that they're actually reacting to pollen. And this is happening from cytokine reactions. So cytokines don't only affect food, they can also be environmentally triggered, and this can cause behavior issues and cognitive and attention problems. So that's a pretty provocative introduction to some of the different things that can be irritating to the system. Let me open the gallery for questions and see what kind of things you are most interested in hearing about or that you've noticed with your own family.
Thanks very much, Kelly. That was very interesting. Barbara asks, is fish oil really as beneficial for kids with ADHD as it is said to be?
Oh, excellent question, Barbara. And I'm glad you've jumped over to the second part, which is replacing what could be missing. There have been actually some research studies that have found that kids with ADD and ADHD, also interestingly kids with autism, which is sort of a tangential, more serious version of attention issues, and also kids with learning disabilities, specifically dyslexia, do have lower levels of the kind of fats that are found in fish than a matched population. In fact, it's so serious that dyslexia chemically is now considered to be a problem with DHA. DHA is one of the fats in fish oil. Fish oil has two major fats in it, EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. These are called long-chain fatty acids. You've probably heard of DHA because it's put in prenatal vitamins now, and it's also put in infant formula. And if you take fish oil yourself, you will see that the two active ingredients are listed are DHA and EPA. They found that in dyslexia, the problem is actually metabolizing DHA in the brain. So we know for sure that DHA is very critical for the subgroup of kids with ADD that have dyslexia. In terms of just general ADD, because fats are structural nutrients, you will take these fats and you will incorporate them into your brain the way that you would incorporate a brick into a wall. So the kind of fats that you have will change the way your brain functions. Now, this may not be immediately obvious, and of course there can always be other factors at play because, once again, ADD is a very big place. It's a symptom that could be the forerunner for many, many different kinds of conditions. And so, in general, I think that people with ADD, adults and children, can do very well with fish oil, but by itself it might not be the only factor that you need to consider.
Which food dyes affect ADHD symptoms more than others?
That's going to depend on the person. They all have the potential to affect it. The common wisdom is that the yellow and red dyes are the worst, but and in studies they've been looked at, I think, the most because the red 40 is the most commonly one that's used, but because all of the petroleum-based dyes have to use liver pathways to break down, it's going to depend on which pathways they're using, and in that individual person, which of those pathways are the weakest. So not to get into too much complex chemistry, but you basically break down dyes and drugs through two basic steps. The first step uses a bunch of liver enzymes called cytochrome P450 enzymes. And this step is the equivalent of sorting what you're trying to break down and deciding what to do with it. So it would be like you going into your closet and saying, okay, this goes to Goodwill, this goes into the trash, this goes to my sister. It's a sorting process. And that's what step one, through the cytochrome P450 enzymes, that's what happens there. And those enzymes are genetically determined. And some people have very good enzymes all the way around, and some people have weaker of some enzymes. And there's about 8 or 10 of them that are highly associated with breaking down medications and these dyes. So it would depend on which enzymes are breaking down which dye and which enzymes that individual has in good number and which ones they may be weak in. I don't know if that makes any sense, but that's one situation. And then the second step of detox is called conjugation, and this is the equivalent of putting your stuff by the curb and having the Goodwill truck pick it up, or the Ambets or something, or throwing it in the trash. And so you're basically taking it out at this point. And when that step is clogged up, the byproducts of the drug, or in this case the dye, kind of sit in the blood too long, and they can cause problems. So there's many steps along the way that can cause an issue. What we find is that people with the most serious problems with medications and with dyes are very good at sorting, like going through the closet and figuring out what needs to go where, but they're very slow at having that picked up and taken away. So they have good phase 1 but weak phase 2. And in that case, these byproducts that have been packaged and ready to be shipped out are sitting around too long, and many of them are biologically active and cause problems. So it will depend on how this whole system operates in the individual. And by the way, this is the, remember the Feingold diet, Ben Feingold from the 70s? This is the chemistry that explains why he was right about artificial colors and flavors and some salicylates in food. He was observing this in people, but we didn't have the chemistry to understand it. And what I just described to you is the chemistry that understands that.
Very good. Gino writes, I've heard that zinc, magnesium, and copper are good for ADHD. Is that correct?
Zinc, magnesium, and copper?
Yes.
Well, again, just to remind you that ADHD is a big place, so there will be a subgroup where some of these things will be helpful and there will be other people where it won't affect. And the important thing to know about that is just because it works for somebody else doesn't mean it will work for you, but that also doesn't mean that it doesn't work. So most of these things do work, and they also don't work. So I just want to make sure that people are very clear about this. You shouldn't be looking at this in black and white. Most of the things you're asking about do work for some people and don't work for other people. So I'll start with zinc first, and copper. They often go together. Zinc is a nutrient that is low in a processed food diet or a white food diet. So if you're eating a lot of milk products and bagels and pasta, all those white foods, they are very low in zinc. And the reason that zinc might be very useful in ADD is because there have been some interesting research studies that have looked at toxin exposure and ADD, and it looks like when you're exposed to certain kinds of pesticides and poisons, there's a lot of symptoms that evolve neurologically that are very similar to ADD or ADHD symptoms. And it turns out that zinc is very important to regulate lead and arsenic in the body. And I don't know if you saw some of the studies that were done in the District of Columbia, but it turns out that lead exposure is highly associated with learning problems all of people's lives. And that there was a small problem in D.C., or they thought it was a small problem, where there was a little bit too much lead in the water, and they followed people whose kids had that water to reconstitute formula. And they followed them down the road, and over 100,000 of these kids, when they looked at them, they had a lower IQ by about 4 to 5 points just based on this lead exposure when they were very young. And your chances of picking up that lead are much less if your zinc status is strong. And so having a diet that's rich in zinc is very good for sort of resisting that. And also zinc helps immune functioning and growth. Copper is balanced with that. Now, while I have not seen any really good research tying that to ADHD, usually you have to have zinc in balance with copper. So you don't want to have too much copper to zinc or too much zinc to copper. And so we generally put those two things together. Magnesium is a lot more interesting, and that is more associated with ADHD, the hyperactivity version of ADD, versus the inattentive type of ADD. And what happens is magnesium helps you regulate how your nervous system operates. And so if you remember from high school biology, when you send a nervous signal down your nerve cell, the potassium inside the cell drifts out to the outside of the cell, and the sodium on the outside drifts in, and they go back and forth, and this is what allows the signal to be sent down the myelin sheath, and so that your nerves can send it like electrical signal along the line. And the thing that pumps this potassium and sodium back and forth is magnesium. So if you don't have enough magnesium, your nervous system doesn't run smoothly. So a typical symptom of really bad magnesium deficiency would be like a lot of eye blinking or twitching, or your restless legs, where your legs are very irritable, or jumping up and down. A lot of things that look like hyperactivity and distress, because magnesium has a very strong calming effect on the nervous system. And magnesium also is low in a white diet. It is found in beans and greens, and these are two things that are very low in American diet in general, and can probably are even a little bit lower in diets of people with attention issues, because very often, for a number of reasons, they can be picky eaters and have some issues with eating. So yes, magnesium and zinc are both very high risk nutrients for this population, and both of them have ways that they can help with certain kinds of attention.
Robin has a question. My daughter is 12 years old, very skinny, and a very picky eater. I mean, very picky. It is hard to get her to eat protein. No beans or eggs, only chicken, and she prefers it in nugget form. She is resistant to any new foods. Any suggestions on protein supplements for kids with very sensitive tastes?
Yeah, that's a good question. And of course, it follows just with what I was talking about with these kind of diets. So thanks, Robin. That was very timely. Well, not to plug my book, but I do have 2 chapters in my book for exactly how to deal with this, cure your child with food, because this is we could talk the whole time just about picky eating. It's a very timely and an important subject, and unfortunately we have an epidemic of picky eaters, and 12 is a tough age because it's pre-adolescent, and usually kids are the least flexible at that point. But what you can do is there's a couple of simple things you can do. And the first thing is that you can kind of insist. I know this is going to sound weird, but you can set up some general rules about eating, and then help her to introduce new foods by picking one food at a time and repetitively trying it. So what most people don't realize about eating is an acclimated activity. So you eat what you're used to. And of course, if you're in a situation like your daughter would, where you won't try it, so you can't get used to it, so you don't like it, so you won't try it, so you can't get used to it, so you don't like it, you're in a cycle. The way to break that is you have to try the food. And of course, she says, no, I'm not going to do it. So you have to pick one food, because most people can tolerate one bite. And you take one bite of that same food, like for 10 or 12 or 14 days in a row, to see if you can acclimate to it. Because the first couple times you try a new food, especially if you've gotten to age 12 and you're pretty picky, it doesn't taste right. It tastes, ugh, it's like you gag, you kind of go, ugh. And that'll happen the first 3 or 4 times, but as you get to the 5th and 6th time, you start to calm down about the difference of it, and you start taking, having an ability to perhaps taste it. And she doesn't have to love it, but we have to get her used to the idea that she can try new foods and it's not going to kill her. And they've looked at this issue with kids with anxiety about eating and anxiety about trying new things, and the only thing that fixes it is having a good experience or having a successful experience doing something that's hard for you. So basically you have to overcome it by dealing with it. And if you're having too much of a problem with this, I would highly suggest that you get some professional help to do it, because at 12, kids can really dig in their heels. But you have to set up a way where she has to try the food, and normally the way I do that is with a system I call when-then, which is, this is your food homework. We're going to try one bite a day of, and you pick a food that is similar to something she eats already, like perhaps a plain piece of chicken, since she mentioned she eats chicken nuggets. And you can give her a choice. Do you want to try plain chicken, or do you want to try, something else, a fish stick, just like a chicken nugget, we'll call it a fish nugget. And to which she'll probably say, no, I don't want to try any of that. And then you pick and keep moving. That's fine. I'll pick this time. You can pick the next time. You want to keep it open so that she can join in with you. But the bottom line is you want to set up a structure. And then this is the most important thing. You have to give her a reason to do it. Because quite frankly, why should you try anything new? What are you going to do to her? Make her. And of course, unless you're willing to do some really nasty stuff, which I'm hoping you're not willing to do, you can't make somebody do that. So you have to set up a system where they need to do it. And this is part of systems therapy, where you set up a when then because you can't make her. So when you're done with your food homework, then we're ready to turn on the computer, or then we're ready to go visit your friend Sarah, or then we're ready to watch TV. And you set up a natural consequence that doesn't involve food. So you don't withhold the rest of her dinner. You say, when we're done with this, then we're ready to move on to the next thing. Just like, when you go to work, then you get paid. And it's not like you're punishing her. You're just setting up something where it behooves her to do it, because at the moment, you haven't given her any reason why she needs to. So hopefully that helps. And if you want to read more about it, I have 2 full chapters about that in my book, and it outlines this in great detail.
A lot of people have asked, is there any relationship between a gluten sensitivity and ADHD symptoms?
Wow, that is a really, really big question. I could spend the rest of the half an hour talking just about that, and sometimes I do. But it turns out that, yes, there are a lot of symptoms of gluten sensitivity that are neurological. So we would have to say, yes, that's true. Gluten sensitivity has a set of symptoms that are digestive, like gas and bloat and stomach pain and chronic mouth sores and diarrhea and that kind of thing. And then they have a set of symptoms that are neurological, like fuzzy brain, headaches, mood disorders and mood swings are very common things that go with gluten sensitivity. So yes, there's a lot of symptoms of gluten sensitivity that look like attention problems and impulsivity and stuff like that. The problem is that there's not a good test for gluten sensitivity because they have not been able to identify the protein that causes gluten sensitivity. They know what causes celiac disease, but if you don't have celiac disease and you're not allergic to gluten, they don't have, although there's tests out there that tell you, really not been a test that's consistently been found to be able to prove this other than to go off the gluten and see if things get better. So getting back to Stephanie Seneff, who I mentioned earlier in when I was going to PowerPoint presentation, she says that the reason they can't find the protein for gluten that's causing gluten sensitivity is because it's not gluten. The problem is that they have a new practice over the last 6 or 7 years where they treat wheat plants with glyphosate 3 days before they harvest it. And what they do is they spray it on, it's an herbicide, you know it as Roundup, right before harvesting. So there's a good deal of glyphosate left on the plants. This starts to kill the plants, but allows the plants to be at an even point of degradation so that they can clean up the fields more rapidly. And that is the glyphosate reaction that's making people so sick. And if you want to read a little bit more about this, I wrote a blog piece for the Huffington Post about it. It's called Eating Wheat Again, Part 2, which is about this problem. And Eating Wheat Again, the main article was about the use of organic or heritage or heirloom wheats for people who are gluten sensitive. It's kind of funny. A lot of people can eat them, but they can't eat regular traditional wheat, which sort of argues for Dr. Seneff's theory.
Carrie asks, she says, experts usually recommend complex carbs instead of simple ones to avoid sugar spikes that can worsen some ADHD symptoms. Can you tell me how to distinguish between complex and simple carbs?
Well, simple carbs are really, they used to call them sugars, and the complex carbs they used to call starch. So if you think about them as sugar or starch, that's basically the way that you distinguish between them. So the simple sugars would be things like anything that would be added sugar, beet sugar or corn syrup or corn syrup solids or high fructose corn syrup. Those would be simple sugars. There are simple sugars in fruit, but I don't. I try never to restrict fruit in people's diets because most Americans don't eat enough fruit and vegetables to begin with, and it's harder to overdo fruit because you can eat 10 apples worth of sugar very easily by drinking a soda, but it's pretty hard to eat 10 apples because the fiber and other food value will stop you. So whole food works better because it kind of regulates itself. Whereas these sugars that are refined take all those regulating factors out, so you can eat lots more of them. So it would mostly be added sugars in terms of simple sugars, maybe honey. Like I said, there are some sugars in fruit, but I'm not as worried about those two foods so much, because how much honey can you really eat? And then the starches would be things that would be like in beans and vegetables and whole grains. Those would be the things you'd want to deal with. Those are the complex carbohydrates. And then things like white flour or processed flour or white rice, those are also towards the simple sugar realm, because by removing the fiber in these products, you make them more simple sugar oriented. So if you look at brown rice compared to white rice has much more simple sugar in it, and brown rice is more carbohydrate oriented in terms of complex carbohydrates because of the fibers that are still left in it. So that's back to the white diet again. So the white flour and the white sugar and the white rice, those are the things that are more simple. And then the brown rice and the beans and the vegetables, those are more complex.
Okay. Beth asks, is anxiety also affected by pollen? A lot of kids with ADHD also have high levels of anxiety.
Yes, Beth, and that's a very good question. And again, it was 2/3, and the way that Dr. Boris did this experiment was that he took the kids with ADHD and he divided them into two groups. And in one group, unbeknownst to them, they had pollen sprayed up their nose. In the other group, they had water sprayed up their nose. And then they looked at what was going on with that. And I mentioned the shirt chewing. This is not part of his study, but something I've noticed for many years, and sort of not sleeping well. These are all things that can happen, because part of what happens when you're having reactions is that it can take your stress hormones up as part of that reaction. Like your heart rate can go up and your glucocortical hormones can go up, and then that makes you feel more panicked or more agitated. So they can go hand in hand.
Okay. Is there a reliable test for food intolerances or sensitivities?
Well, I think the most reliable test is to go off the food and then see if the symptoms get better, and then to add it back in. And the reason that I think this is the best test is because it's very often we're finding it's not only the food, it's other stuff we've done to the food. So in the case of wheat, I started noticing that people would go to Greece or France and they could eat wheat and they couldn't eat it here. And so that started making us wonder about something we're doing to the wheat or something else beyond just the gluten, because obviously if it was gluten by itself, then they'd have problems both places. And of course, some people do. The same with the fruits and the vegetables. I mean, there's even with organic food, sometimes there's waxes or something that's added to it. So food is not the simple thing that it used to be in many cases. So I've noticed, for example, people will say, oh, my child is allergic to strawberries. And strawberries have very low reactivity, but they are probably the number one pesticided produce item. And because they're so porous, all that is sprayed on them goes in and is in there completely. So everything that's been sprayed on the strawberry the entire time it's been produced, you're eating, because there's no place else for it to go. I mean, there's no hard surface you can scrub off. It just is porous and all goes inside of it. So when I've moved kids like from commercially produced strawberries to organic, very often they started doing better. So it turned out it wasn't the strawberries so much as it was something else. So I think the best test is to get rid of it. There's another test called IgG sensitivity testing. It's used a lot in the holistic community, but there's one lab that I've used some, but you have to be very careful because it's a test that's very prone to false positives. So most of those laboratories, no matter what, you get 15 to 20 things that come up positive. And I just have found not to be all that useful. I think that there's way too many positives. Mm-hmm. So if you eat it enough, on that test it almost comes up positive. There's one lab that is not so bad. It actually sometimes even has a negative result for all foods. And if you have a lab that always has at least 10 to 15 to 20 things come up positive, there's something not quite right with that test.
Someone referred to one of your slides earlier about kids falling apart in spring. And she says, what do you recommend? My child chews on his clothes and chews on his fingers and his behavior changes. but his eyes and nose aren't affected, so she's asking for some kind of practical game plan for that.
Yes, thank you for bringing that up because that's a very important point. Well, even though it shouldn't be a traditional histamine reaction because you're not having the runny noses and eyes, ironically, one thing that we have found has been very useful anyway is antihistamines. You should talk to your pediatrician about that, of course, and get some input from a practitioner who knows your child well. Some kids with ADHD don't do well with antihistamines and can get irritated on them, but that would be one thing to look at. And years ago, when I started noticing this, we would send people back to their pediatricians to try antihistamines, and surprisingly, they often worked. I mean, I had this very bizarre situation many years ago where I really got very tuned into this, where this child started chewing all the skin off of her hands suddenly, and nobody knew why, and it was getting to be a medical crisis point. And I was looking out my window, and I noticed that the trees had buds on, and I was trying to think, what could be bothering this poor child? And I said to the mom, well, do you think she's having spring problems? And she said, absolutely not. Her nose isn't running. All is well. But it was either that or some very, very nasty medication. So she went back to their doctor, and they did a trial of an antihistamine, and the behavior stopped in 24 hours. So after that, it's not a perfect thing because the pollen levels are very, very high. And even when people take antihistamine successfully, it doesn't always take care of everything. But you could talk to your doctor and try that for a week, and if that behavior goes away, there you have it. Now, if you want a natural approach, and again, because pollen levels are so high because of global climate change, the natural approaches do not consistently work well. But you can do a combination of vitamin C and quercetin, Quercetin. This is an antioxidant that sometimes is very good, works like a natural antihistamine. And you can do a dose of quercetin and vitamin C twice a day, and some people find that this is useful. There's actually even a product called D-Hist. I don't sell anything, so talk to your doctor or look into this if you're comfortable. That is a combination, or if you go to the health food store and look for natural allergy products, you'll often see some quercetin and vitamin C mixed together, and that might also be useful.
That's good advice. Once again, referencing dyes, one parent asked, do you recommend cutting all dyes from a child or even an adult's diet? And how do you do that?
Well, I do because, why would you want to eat petroleum if you didn't have to, right? And most of the food that dyes added to, let's face it, how much healthy food is laced with artificial color and flavor? You're talking about getting rid of candies and things that glow in the dark, and usually juice drinks, which for other reasons like the sugar, we want to get rid of those anyway. The Obama administration gave some incentives to these soft drink companies to come up with lower sugar alternatives because this sugary drink situation is hit almost a crisis level. So, just don't buy anything that has artificial color and flavor added to it. And if it has an unnatural color or glows in the dark, don't buy it. I mean, I think it's actually fairly easy to avoid most of that stuff.
So be a vigilant reader of food labels.
Yes, and they do have to label dye. I mean, lots of junk is hidden in food and doesn't have to be labeled clearly, but dye has to be labeled. And so unless they're, lying through their teeth, it should be labeled. And also, a lot of stuff that's dyed, it looks a lot brighter and happier than it would normally be. You'll notice that if you go to Whole Foods and you look at their candies and stuff, they're kind of dullish. That's because they're using beet dyes and the natural dyes, which have a much duller kind of color to them.
One adult asks, I am concerned about herbicides and other chemical sprays and how they might be affecting my ADHD. Do you know if they affect ADHD symptoms specifically? If so, should I be eating only organic foods?
That's a really good question. And actually, they did a study where they looked at specifically at pesticide levels in kids that were diagnosed with ADD and other kinds of conditions, and they did find higher levels. And so because there's so many neurological symptoms associated with pesticides and herbicides, I do think that is an issue. And of course, if in as much as you can afford to do it, why would you eat pesticides? I mean, most of us do the best we can, and if you eat out, it's kind of tough to avoid them. But I think in as much as you're buying the food and you're preparing your food, why not buy as much of it organic as you can afford to do? Because the more of us that buy the food, the more they offer and the cheaper it gets. So I think that you vote with your pocketbook. And I think that if we all say we don't want food that, we don't want wheat that's been sprayed with Roundup 3 days before it's processed, I mean, to me, that's absolutely horrifying. I don't even know what to say about that. Eventually, if we all scream loud enough, I think that they stop producing it. I mean, you can get organic food at Walmart, now. So the more people that want it, the more that they'll produce.
Tiffany asks, would you recommend that adult children see a nutritionist or follow a diet like Feingold's? Also, are there any books you would recommend to follow for dietary guidelines?
Well, the old Feingold diet has been updated a lot in some of these ADD and nutrition kind of books. As we mentioned from the other question previously, I don't think there's any reason why anybody should be eating food dye. I think that they should just take it out of the food. It's not particularly safe, and all it does is it's just more of a marketing tool. It doesn't add flavor to anything. So, yes, I think that you want to remove as many irritants and keep the diet as clean and as supportive as you can, because when you're looking at ADD, you're looking at somebody who has challenges with their neurological system, and you want to level that playing field in any way that you can. Pam Compart and Dana Lake wrote a book called The ADHD and Autism Cookbook that has some recipes and talks about some things that can work with this. There's another book, I forget the woman's name, I think it's Zimmerman, who wrote a kind of a challenge book where you go on a kind of a clean diet for many days, and then you start adding food back to see which one will work or which one might be bothering them in terms of ADHD. And then, of course, there's my book, Cure Your Child with Food, that has a bunch of other ideas in it.
Mm-hmm. If your child is allergic to fish, can you recommend an alternative source of DHA?
Oh, that's a very good question. Yes, there is one basic alternative source, which is seaweed, because that's exactly where fish get it. Believe it or not, the reason that farm-raised fish don't have the right kind of fats in them is because they're often fed grain, and if they were out in the sea, they would be eating seaweed, and they would be concentrating the DHA from the seaweed. So all the vegetarian and alternative sources are seaweed-based, and there's a number of companies that make that. For vegans, you can, and also for babies, there's Nordic Naturals makes an algin, which is an algae-based DHA in a liquid. And surprisingly, they're pretty strong. Like you'd think, oh, it's not fish oil, so it won't be as strong, but in some ways, it's kind of stronger.
Are there any general recommendations about how much fish oil a child with ADHD or an adult with ADHD should take each day?
Well, of course, you should run that by your health practitioner, but in general, over about age 3 or so, I like to get at least 1,000 milligrams of a combination of EPA and DHA as a therapeutic dosing. Now, I want to be really clear about this. A lot of companies say 1,000 milligrams of omega-3s on their label, and they may have as low, in one case I saw, as only 100 milligrams of the active ingredient. So you can say omega-3s is a sort of a general overall description of this stuff, but what you're really looking for is the active ingredient. So I want 1,000 milligrams of DHA and EPA in some combination as a general kind of starting therapeutic dose, and then you can kind of go from there. But be really careful that you read the label carefully, because very often they advertise a much higher number, and they're including all the fats and not just the therapeutic fats. And I don't even know how they're doing it, because in one case, it was only 10% EPA and DHA. They were advertising it as 1,000 milligrams of omega-3s, and I don't know how they were doing it.
My 11-year-old son has extremely picky eating habits, which seem related to sensory issues and anxieties about appearance of food. He becomes easily turned off of food if associated with anything he thinks is gross, like his baby sister. He has difficulty taking supplements because of size or taste, and is very drawn to sugar. Have you noticed any kind of relation between sensory issues and picky eating habits?
Well, yes, as a matter of fact, sensory issues are one of the main problems with picky eating is that sensory issues usually come from immaturity and nervous system development, and so these kids experience the sensory world very differently than the rest of us. So something that's pleasant and lovely to us can be very offensive to them. And like I was describing in the picky eating program earlier, you really do have to help them to acclimate by tolerating small changes and a little bit of discomfort. And it's almost like having a frozen shoulder where you have to move it slowly to get it into a better position. This is very, very important for them because if you're not careful, kids like this get narrower and narrower, and then all of a sudden they don't eat this brand because they had a bad experience at one day, and the anxiety starts to collapse in on themselves. So you want to come up with a program and perhaps get some help that you are going to stretch that a little bit and sort of, again, insist in small amounts that they learn how to tolerate a little bit of this discomfort, because if he keeps on narrowing in his own world, more and more stuff's going to get gross to him, and then these kids find themselves in a really tough situation. I once saw a 16-year-old who couldn't even date because she had gotten down to 2 foods, and they weren't foods that you would normally go out and get with the date, and so she was finally had enough stimulation to go and get some professional help with it because she realized her world had gotten so small from this, and she was so stuck and traumatized at that point she didn't even know where to start. So cognitive behavior therapy, where you're really experiencing the new experiences and conquering them and overcoming them. There's an excellent, excellent article I highly recommend that was in last month's Scientific American Mind magazine called Fear Not Child, which is about what they're doing and the only successful treatment they've had for a lot of these fear and anxiety-based disorders with kids. I highly recommend it if you haven't seen it.
Kelly has a question about weaning a child off of sugar. Do you have any tips on how to slowly do that?
Well, I think getting off the sugary drinks, which we mentioned earlier, is a very good place because that's something easy to do and you still don't have to cut back any cookies or anything like that. But, I mean, the one big tip is don't expect them to be all excited about this. They found that sugar is as addicting as heroin for a lot of people. And so you can't expect your 5 or 6 or 10 or 15-year-old to go, oh, yippity-doo-dah, I'm going to get off of my favorite food. They're not going to go along with you and be part of the program. You're going to have to be doing it with them, and at least in the beginning, they certainly aren't going to be excited joiner-inners of this program. So please don't think that this is something they're going to want to embrace wholeheartedly. So you start with getting rid of the sweet drinks and stuff, and then you start by just making up rules about what you do as your family values, like, oh, 1 dessert a day or, 1 treat a day, and you just set it up as a structure. And you help, and then expect them to give you a whole bunch of nonsense about it. No, I want 2, and to beg and plead, and because that's probably worked in the past for them. So you want to set up a structure for them where it is, the new family rule. We say our prayers before bed. We, brush our teeth. We have 1 dessert, and that's just what you guys all do. And that often helps a lot because, in essence, you are making it up. I mean, there's no law about what you have to do. There certainly are recommendations, and if you look at the American Pediatric Association, they recommend not having more than 4 ounces of juice a day, and they're pretty conservative in terms of their recommendations. And the American Heart Association said there shouldn't be more than 100 empty calories in a diet per day. Well, you eat 1 or 2 cookies, and that's way over that. So I think that you want to just make up something that's going to work so you don't feel too restricted. There's some flexibility, but that there's a family value that you guys mostly try to follow.
Okay. And I think this will be the last question. A lot has been discussed on foods to avoid, says Judy. What foods in general should children with ADHD focus on? I guess that's just basically good eating habits, but...
Yeah, that's a great finishing up question. Thanks, Judy. Yeah, I think that the closer it is to the way that it falls out of the field or comes out of the farm, the better. So I'm really a big fan of one ingredient snacks. I mean, it's hard to go wrong with an apple or a pear or carrot type thing. So I think the dietary surveys consistently find that kids don't eat enough fruits and vegetables. In fact, less than 20% of American kids eat the recommended 4 servings of fruits and vegetables a day. So you're constantly trying to boost that up because that's where we're very weak. We have what's called high-calorie malnutrition in the United States. We have lots of calories in junk food, but not the concentrated nutrient foods. So I think you want to concentrate on plant foods, fruits and vegetables, and you also want to concentrate on making sure that there's protein, a little bit of protein with each meal, because that tends to keep people's temperaments more even. So I think that would be another important thing to concentrate on. And, and decide what you want to do, and as much as you can with the family, try to, if you're married or you have a partner, get agreement as much as you can, and just make some small changes that everybody can live with. It's very, very hard to tell your kids to do something different than you're willing to do. I can't tell you how many parents have dragged kids in to see me and say, made them eat vegetables, and they don't eat vegetables. So you're at the starting point, so you set the example, and then you set the family value, and you all try to do it together. And for goodness sakes, don't buy anything you don't want your kids to eat. If you don't want them to eat it, don't buy it.
Excellent advice there.
Yeah.
We will have to end it there. Thanks very much, Kelly. It has been enlightening for everyone. I know it was for me.
Well, thanks, Wayne.
Have a good day, everyone.
For more Attitude Podcast and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.